Apple cider vinegar, or ACV, is sometimes used as a natural remedy to help regulate blood sugar levels, especially for people with type 2 diabetes or prediabetes. While it's not a replacement for medical treatment, ACV can have a positive impact on post-meal blood sugar levels. How to mix apple cider vinegar and water for blood sugar control. Standard dilution: 1 to 2 tablespoons of apple cider vinegar, preferably raw and unfiltered, mixed with 8 ounces of water, which is about a full glass. Timing: drink this mixture before meals, particularly meals high in carbohydrates. It may help slow down the digestion of starch and prevent spikes in blood sugar. Optional: add a small amount of honey or lemon to improve the taste. Though honey contains sugar, so this should be done cautiously if your goal is to manage blood sugar. Cautions: start slow. If you're new to apple cider vinegar, begin with 1 teaspoon in water to see how your body reacts. Protect your teeth. Apple cider vinegar is acidic and can erode tooth enamel, so it's best to drink it diluted through a straw and rinse your mouth afterward. Check with your doctor. If you are taking diabetes medication, consult your doctor before using apple cider vinegar regularly, as it may affect your blood sugar and medication dosage. Apple cider vinegar may help improve insulin sensitivity, but it should complement a balanced diet, regular exercise, and your healthcare provider's guidance. Please leave a comment below. If you want more health tip videos, please subscribe to our channels.